In this video, I'm demonstrating how to properly assemble the C-arm for an operation we're about to perform. So I'm bringing the wire around the backside of the monitor and the C-arm and plugging it in. The reason why I'm bringing it around the back is so that way the wire doesn't get in the way when we try and move it into the table for the surgery. So I am plugging in the monitor to the C-arm, ensuring both red dots are in line. Now that I have this done, I can go around and plug in the monitor to the power source. And the reason why I do this last is to avoid any electrical issues. So now I will just turn it on and wait for it to load. In this video, I'm setting my technical factors. Since we are doing a hip surgery, I set it to orthopedic. And I also clicked on low dose, so that way we ensure that throughout the surgery, the patient is receiving the lowest dose possible. Some features to note on the monitor would be the KVP and the mass selectors. So these can make the KVP go up and down as well as the mass. So those may be needed in some cases. As you can see, when I clicked on orthopedic, it set an automatic technique of 70 KVP at 2.5 mass. When you look to the left of the KVP and the mass selectors, you'll see some collimating options. There is one called an iris where it opens and closes in a circle, and that helps with collimation. And then there's one that collimates up and down and side to side. So collimation is great because it helps reduce patient dose and makes the images more clearer. So we use that when we can. So moving on to the left of that, there is a norm, a MAG1, and a MAG2 option. The MAG1 and the MAG2 magnify the imaging and the anatomy for the surgeon if needed. We do tend to stay away from that because it does increase patient dose, because it increases the technique that is needed. To the bottom of that, there is a triangle and a blue circle, and this will turn on and off your laser light, which helps you in centering and positioning the tube while the patient's on the table. To the left of these buttons are our orientation buttons. There is a left and a right arrow, and these buttons will help you to rotate the image in both directions if needed. Directly under that, there is two R's. One of these R's will flip the image left to right, and the other will flip it up and down. This may be needed depending on how the patient is positioned for the surgery, and we want to ensure that the patient's images are displayed for the surgeon in anatomical correct position. Directly underneath this is our save and swap button. The save button will save the image that was taken, and the swap button will swap the image that's on the monitor to the image that was just taken. Overall, these are the most commonly used buttons on our control panel during a surgery case. During a procedure or a surgery, when an image is saved, the screen is split into two sides, a left and a right. When you save an image, it pops up on the left half of the screen. So right here, I am saving an image and I'm swapping it. So now that I'm swapping it, the photo will show up on the right side and any new saved images will show up on the left side of the screen. Now that the case is complete, I'll need to send my images through the PACS system. I do this by clicking on the Images tab, and then I hit Select All. I remove the patient summary, and then I hit Send. And I wait for this to completely send before shutting off the system. Taking a closer look at this screen, you can see that there's a dashed line around the patient summary, which ensures me that it won't be sent with the dose summary and the images from this case. In this video, I'm demonstrating the range of motion of the C-arm. I'm slowly pushing it in while lifting it with the up and down arrows to make sure that I clear the base of the table. So I turned the handle at a 90-degree angle to move the wheels so I can easily move the C-arm from side to side. Now that I have it in a good spot, I'm just pushing it in. And now I can go ahead and demonstrate the 5 different locks of the C-arm. So the first lock that I am manipulating is the gray lock. And this gray lock serves almost the same function as the orange lock. However, at our site, we never use it, and I'm just making sure that it's zeroed out. The blue lock allows us to move the C-arm to a lateral or an oblique position and back to an AP, and typically we call this rainbowing. So as you can see, while I'm doing this, I am moving the tube up and down so that way I can ensure that I don't hit the table. The next lock that we have is the green lock, and this green lock allows us to move the C-arm in and out. This makes it especially helpful for centering. The next lock that we have is the yellow lock, and this yellow lock will actually allow us to wig and wag. So this allows you to pivot the machine. And then the final lock is the orange lock, and the orange lock allows you to angle the C-arm caudally or cephalically based on the patient's orientation. And now that I'm finished, I'm going ahead and making sure that everything is zeroed out for the next case. In this video, I will be demonstrating how to disassemble the C-arm. So I'm pressing that power button and it starts blinking green. Once it stops blinking green, then I'll go ahead and unplug the cords. An important thing to note is before I did this, I made sure the C-arm was lowered all the way down, because once it's powered off, you can't do that anymore. I'm unplugging the monitor from the C-arm, and I'm going to be wrapping that cord around to ensure that there's no damage to the cords, especially while they're being stored. Now that I have that cord properly secured, I will go ahead and now unplug the monitor from the power outlet, and I'll be wrapping that cord around the same way. And after I'm done with all of this, before we park the C-arms, I will go ahead and wipe down the surfaces of all the areas on the C-arm and the monitor, including the cords.